Hey you guys, welcome back for another week of Work It Out Wednesdays. Y'all know on Wednesdays we work out a practice question to test your knowledge on the material that we are covering for the week. For this month, you know that I am working through the non-clinical series for you guys, focusing on the research topics this week. So these questions for today are a couple of research-based non-clinical questions to test your knowledge. And if you haven't had a moment, go check out the video from yesterday where I work and go through those topics for you. So if you're struggling with those or if you need to review those, that should give you some help. But a couple of questions from my review book. Let's go to it. The Nurse Practitioner Association is conducting a study to see what test is most beneficial to take. Read the following evidence based research models and select the strongest model. All right. Is it A? A nurse practitioner of 20 years gave an expert opinion that the AANP was the most beneficial. She states this is the most beneficial because it supports the nurse practitioner organization. B, a university conducted a systematic review that showed that the ANCC was the most beneficial. C, 10 nurse practitioners at a local hospital submitted case reports, and 50% found that the AANP was most beneficial, and the other 50% found the ANCC most beneficial. Or D, a randomized control trial was conducted at a university and found that the two certifying boards were equally beneficial. All right, you guys, I know that's a little more terms and definitions and explanations and studies. So take a moment, read through that, tell me your answer choice, put it in the comment. Let's see what you got. All right, you guys. So, as I always tell you, read the stem of the question first because why? You want to make sure that you are answering what they are truly asking. If you do this enough, you know that's what I always tell you. You should be saying it along with me, right? So, the stem of the question states read the following evidence based research models and select the strongest model. So, I want you to go through these four and tell me which one's the strongest. So, again, a nurse practitioner of 20 years gave an expert opinion that the AANP was the most beneficial. She states that is the most beneficial because it supports the nurse practitioner organization. B, a university conducted a systematic review that showed that the ANCC was the most beneficial. C, 10 nurse practitioners at a local hospital submitted case reports, and 50% found that the AANP was most beneficial, and the other 50% found the ANCC most beneficial. Or D, a randomized control trial was conducted at a university and found that the two certifying boards were equally beneficial. Now, this is where that research hierarchy pyramid comes into play. Go check out the video from yesterday. I stress this. If you've done any of my courses, you know I stress study this. Know what these evidence based models consist of, know which one is strongest versus the weakest, okay? The pyramid helps you to see it clearly, to know the order that they fall into. So we know the strongest study is what? Is that systematic review, right? Meta-analysis up there with the systematic review. But the top of the top is that systematic review. Remember, like I was telling you yesterday in the video, that, hey, the systematic review takes all research into play, which limits the bias, right? So I tell you to think of it as the systematic review is reviewing everything. We're not leaving anything out, so that's why we're stronger. There's less bias. So since we review everything, we run the system, right? That's the top. So B, a university conducted a systematic review. That's the strongest, y'all. B is your answer. All right, all right. Last question. The nurse practitioner is explaining relative risk to the nurse practitioner student during their clinical rotation. What shows her understanding of the term? Is it A, the ratio of the probability of an event occurring in a non exposed group to the probability of an event occurring in an exposed group? Or B, the ratio of the probability of an event occurring in an exposed group to the probability of an event occurring in a non exposed group? Is it C, the analysis of an adverse event? Or D, the analysis of a risk factor? I'll give you a few seconds to see what you have. Put it in the comments. Let's see what you got. All right. Stem of the question states what shows her understanding of the term. So, of course, we need to see what term are we talking about. Relative risk is the term. So, what is relative risk? And this is what I mean. I talk about that in the video. Non-clinical content, a lot of it is just straightforward terminology, and you just got to know what it is. So, what is the definition of relative risk? Think about that. Now, a lot of times you may see these definitions in a certain fashion, so you need to pay attention to the wording of everything. But in this case, the answer is B. Relative risk is the ratio of the probability of an event occurring in an exposed group compared to the probability of the event occurring in a non exposed group. Remember, it is an equation, it's the ratio, and that numerator is the probability of the event occurring to an exposed group, and the denominator is that over the comparison, the probability of it occurring in a non-exposed group. Okay, check out that video for a better explanation. I hope y'all found this helpful. As always, be sure to like, comment, and subscribe so that you get notifications of all the videos that are posted tomorrow. It'll just be a study video of repetition. Remember, I was telling you guys, because repetition is the key with learning anything and staying on top of it. But the more you repeat it, the more it becomes second nature to you. So we'll be doing that because this is so heavy on terminologies just to kind of get this stuff in your mind. So that's what the video will be on tomorrow. But go check it out again if you haven't seen the one from yesterday that went through these topics. Take a moment to check that out. But be sure to meet me back here. Bye, y'all.